Hello everyone, my name is Joël Pitre, and today I will be presenting a study on the impact of two-page navigation models on health service utilization and quality of life, co-authored by Alain Gauthier, Patrick Timoney, and Diana Urojnik from the Laurentian University, and Simone Darouge from the University of Ottawa. I have no relationships with for-profit or not-for-profit organizations to declare, and this presentation has received financial support from the Canadian Institute for Health Research, the Ontario Spore Support Unit, and the Ministry of Health Ontario, along with in-kind support from the RAND Corporation for the VR12 questionnaire. Today, we see that there's an unequal distribution of social determinants of health that contributes to health disparities in the Canadian populations. Social prescribing programs have shown promise for addressing these health disparities by having a primary care provider refer patients to a lay navigator, which is someone without clinical training. And this navigator helps patients identify and overcome barriers and helps them access community resources to treat their social needs. The objective of this study was to compare the impact of both navigation models within a social prescribing context and that of certain social determinants of health on hospital service utilization and quality of life of patients in Sudbury and Ottawa. Therefore, a secondary analysis was done with data from the 2020 randomized controlled study that compared both navigation models. 326 patients completed the pre-intervention questionnaire and 237 completed the post-intervention questionnaire. Logistic regression was used to model hospital service utilization and linear regression for quality of life. Dependent variables include, under hospital service utilization, if a patient had an ED visit in the last 3 months post-intervention, and if they had a hospitalization in the last 3 months post-intervention. And then under quality of life, we have the physical and mental scores taken from the VR12 questionnaire. Predictors include the baseline, where binary pre-test scores were included in the logistic model, and pre-post test differences were included in the linear model, along with the type of service and some social determinants of health, as we can see in the table. Analyses show that those who had prior ED visits were 3 times more likely to have visits after the intervention, and those who had a university degree were 70% less likely to have visits after the intervention, as illustrated in the figure below, where the gray bars have a lower frequency than the blue bars. No other predictors were significant for predicting the ED visits post-intervention. For hospitalizations, those who had prior hospitalizations were 13 times more likely to have some after the intervention, as illustrated in the figure below, where the gray bar on the left-hand side has a higher frequency than the neighboring blue bar. Once again, no other predictors were significant at predicting hospitalizations for this model. Analyses did not reveal any associations between any of the predictors and the quality of life measures, but there was a trend suggesting that ARC services may help improve physical quality of life more than Ontario 211. This trend was not significant and not present for the mental quality of life, however. So, the results seem to suggest that prior use of hospital services may increase the likelihood of future use, and that higher education may be protective against their use. However, it is advised to interpret these results with caution due to certain limitations, such as the 3-month interval between the administration of both questionnaires and the fact that Ontario 211 was not a true control group, which may have influenced the results in one way or another. That's all for me. Thank you for listening. If you would like more information, I invite you to contact me via email, or you can visit the ARCS project's website. Both of these addresses are located at the bottom left of the screen in front of you. So thank you and have a good day.